Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, and we are coming to you from the Grand Hotel, and we're up here for the Detroit Regional Chamber of Commerce's annual policy conference. And who's more quagmired in policy, right, than you? Brian Peters, the executive director of the Michigan Health and Hospital Association. How you doing, bud?
I'm doing well, Chris. Always great to be with you. Here. Definitely is in the spotlight these days.
Oh my God, certainly is. First of all, let me start with: are you getting affected much by R&D cutbacks, by all the money that's not coming through from federal sources?
Well, certainly we have a number of our member health systems that are affiliated with an academic enterprise, University of Michigan Health being a wonderful example of that. And so, yes, there is some impact there. Certainly when it comes to tariff policy, most folks think of that tariff discussion and they think of the automakers or other sectors of the Michigan economy and don't tend to think about healthcare. But the reality is, think about an MRI machine, Chris. It may be manufactured technically in the United States, but it has 24 components that are critical that come from overseas. And so tariff policy across the board in healthcare, whether you're talking about technology or whether you're talking about prescription drug ingredients, tariffs can have a huge impact.
Well, there's absolutely that, and that's thrown a quagmire into business uncertainty, which is not good in the long run as well. What are your major issues there at the association?
Well, right now, it's all hands on deck related to the Medicaid program because just a week ago, the United States House of Representatives did pass their one big, beautiful budget bill, as we know. And that included very significant proposed cuts to the Medicaid program through a variety of mechanisms. And we're still sorting out all of the particulars there, but we know if that particular legislation survives the United States Senate, where it's going to be under consideration now in the weeks ahead, we know that that's going to mean reduced funding and therefore reduced access, not only for Medicaid recipients here in the state of Michigan, but when a hospital or a health system has to reduce services, when it has to eliminate a service line perhaps, or close the doors entirely on a hospital, and that's a real threat in rural Michigan, by the way, that doesn't just affect Medicaid patients, it affects all of us. We can't access that service anymore, regardless of what kind of health insurance coverage we may have.
Well, it looks dangerously like a step backwards, is what it looks like. And you're right, facilitating the needs of those rural communities can be greatly impacted by all that. So besides the advocacy, the lobbying, et cetera, I imagine you're picking up a lot of partners in this and going and arguing for it.
We really are. It's not just hospitals and health systems, but there are a number of organizations in the healthcare space in particular that are incredibly concerned not only about these proposed Medicaid cuts, Chris, but also you think about the food insecurity issue. We have significant cutbacks to the SNAP program that are on the table right now. We know in the hospital world that if folks don't have access to appropriate fresh food, they're going to end up in hospital emergency departments in short order, particularly if they're struggling with a chronic illness. And having good nutrition on a regular basis is critically important. This is really an example of where prevention is the name of the game. And if we take those investments off the table, the end result is going to be worse outcomes for patients, but actually much higher cost for taxpayers at the end of the day.
Well, I think if you want to follow the dollar, what happens is then they go to the emergency rooms, which is the most expensive healthcare you can get, and it's non-reimbursable because they can't possibly pay for it.
Exactly right. And we believe that many of the folks who may be disallowed from the Medicaid program as a result of these policy changes are going to become uninsured, or they're going to become technically insured, but with high deductible health plans where they're in no position to be able to pay their copays and deductibles, which of course turns into uncompensated care for the hospital, community, and other providers. And that's the whole reason that we came down to the Affordable Care Act some years ago, and fortunately, we're able to extend coverage to so many Michiganders as a result. This really is, as you just said, a step backwards if we're going to see this proposal make its way through the Senate.
Brian, are you hearing any talks about mergers? I mean, there's always mergers that go on, but for the sake of efficiency.
Without a doubt, this is a trend that's been underway for decades now in Michigan, and we continue to see not just independent hospitals joining systems, but now we see multi-hospital systems coming together. We see it in Michigan and we see it across the country. We're also seeing integration of physicians and physician groups that are now becoming part of these well-organized health systems. We believe that at the end of the day, this is a positive for patients and communities because we're able to tap into economies of scale. We're able to utilize emerging technologies more effectively, access prescription drugs in a more effective manner, and really track patients from start to finish through the care continuum in a more effective way.
Well, and technology will be where it comes from. That's huge. Brian Peters, thanks so much for joining us, my friend. Keep up the good work.
Appreciate it.
All right. You're watching the Michigan Business Beat on the Michigan Business Network, coming to you from the Detroit Regional Chamber of Commerce's Policy Conference on Mackinac. We'll be back with more.